David Agas once said, "We may never understand illness such as cancer. In fact, we may never understand or cure it, but an ounce of prevention is worth million pounds of cure." Good evening, everyone. To all present members, I, Soumya Sharma, a second year law student at TIPS Dwarka, welcomes you all to an exclusive webinar organized by Trinity Institute of Professional Studies in collaboration with Rajiv Gandhi Cancer Institute and Research Center on the topic Cervical Cancer Prevention and Control Measures. This webinar would help the students to get detailed tool of guidance for cervical cancer. Today, it gives me immense pleasure to welcome our guest speaker of the event, Dr. Indra Agrawal. On the behalf of the management, I thank her for providing her gracious presence to join us to enhance our joy. I would also like to welcome Dr. R.K. Tandon sir, Chairman at Trinity Institute of Professional Studies, Dr. Barka Bahel, Director, and Dr. Shashi Bala, Principal, Law Department, present faculty members, and all the participants. We would be having a question and answer session at the end, so I would request everyone to put their queries in the chat box. Education is the key to unlocking the world, a passport to freedom, freedom from cancer. Now, I would like to welcome our guest speaker to educate us all, Dr. Indra Agrawal, who graduated from Lady Hardinge Medical College, Delhi in 1986 and did her post-graduation from the same college in 1990. First, she has been in clinical practice for more than 28 years. She joined Rajiv Gandhi Cancer Institute and Research Center 9 years back in the Department of Preventive Oncology due to her interest in community service. And now she regularly conducts cancer awareness and screening. We welcome you, ma'am. Over to you, ma'am.
Thank you so much. Thank you. A very good afternoon, everyone. And it's my pleasure and honor to be here amongst you all and for inviting me to speak on such an important topic. And we all know cancer is a leading cause of death worldwide. It kills nearly 1 crore deaths annually, globally, 1 crore a year. So you can imagine how much a problem the cancer is. And especially the stigmas attached and the misconceptions around the cancer makes it a very dreaded disease. People don't want to talk about it. And it's a big concern these days, and the cancer cases are on rise. So anything we can do to reduce our risk is a step in the right direction. So let's talk about cancer. I think the usual questions. Can you see my screen?
Yes, ma'am, it's visible.
It's visible?
Yes, ma'am.
So, next. So I'll be talking about cancer prevention and early detection. I'll talk about cancer in general and then cervical cancer in specific. My flow of presentation will be magnitude of the problem, what is cancer, our lifestyle and the cancer risk, ways to prevent, common cancers in females, and screening for early detection. So why talk about cancer? Cancer is a leading cause of death worldwide, accounting for nearly 1 crore deaths every year, or nearly 1 in 6 deaths. If we talk about Indian scenario, 1 in 10 Indians likely to develop cancer. Around 50% of the deaths from cancer are due to tobacco use, obesity, alcohol consumption, low fruits and vegetable intake, and lack of physical activity. And these are all preventable risk factors. Cancer-causing infections such as human papilloma virus and hepatitis are responsible for approximately 15% of the cancer cases in India, again preventable. Cancer can be cured if detected early and treated effectively. But the reality of India, this is the grim reality, 70% of the Indians consult doctor when the recovery is difficult. That means 70% of the people are coming to us in the advanced stage. As a result, 70% die in the first year of diagnosis because of the late diagnosis. 50%, as I said, cancers from the lifestyle factors, all preventable. Now, what is cancer? Cancer is... They cannot see my slide? उनको बोलो अब मूव करिए मूवमेंट दिख रही है
अभी हो गई ठीक है
can you see the movement? Yes. Okay, so can you see my slides now? So I'll start with again what is cancer. Cancer is not a single disease. It's a general myth among the public. People feel cancer is just a single disease, but it is a group of diseases. The only thing common is uncontrolled growth, uncontrolled division of abnormal cells. And these cells have the capacity to invade distant organs. Cancer of different organs is altogether a different disease. Cancer of we name the cancer according to the site of origin. If the cancerous cell starts in the breast, we call it a breast cancer. If we start in the cervix, we call it a cervical cancer. Because the risk factors, the treatment, the prognosis, everything is different for different cancers. If we look at the causes of cancer, cancer doesn't develop in a single day. It takes years to develop. And the causes are many. If we look at the causes, there are some intrinsic factors outside the body and there are some inside the body. These just 10% of the cancer cases are because of factors inside our body. We call them genes. Just 10% of the all cancer cases. The rest 90% of the cases, the cause lies in the environment. It could be lifestyle factors, as I said, the tobacco consumption, excessive alcohol intake, obesity, etc., etc. So the 4 leading lifestyle risk factors for cancer are tobacco use, diet and obesity, sedentary lifestyle, and alcohol. These are the four leading risk factors. Tobacco is the most preventable cause of cancer. 40% of cancers in males and 20% of the cancers in females are due to tobacco consumption. 80%, if we look at the mouth cancers, 80 to 90% of the mouth cancers are due to smokeless tobacco. And it not only increases the risk of mouth and the lung cancers, it increases the risk of cancer of almost all organs of the body. So you can see from this, it increases the risk of almost all organs of the body. As I said, mouth and tobacco use normally starts early. According to the survey, 13 to 15-year age group, tobacco consumption was 20% among the boys and 8.3% among the girls. So you can imagine less than 15 years of age, 20% of the boys were using tobacco in some or the other form. And the tobacco industry is very smart. It especially targets the new generation. And in India, about 1/3 of the adult population use tobacco in some or the other form. Like if we look at the smokeless tobacco, 21%, smoked tobacco 10%, and either of that 28.6%. Smokeless tobacco is more prevalent in India compared to the smoked tobacco. Tobacco contains more than 7,000 chemicals and 70 of them can cause cancer. It contains cancer-causing chemicals like formaldehyde used to embalm dead bodies, benzene found in gasoline, polonium-210. It's a radioactive substance and very toxic. Contains vinyl chloride, chromium. The list is a long one. More than 70 are cancer-causing and the rest are hazardous for health. Then the second-hand smoke is also very dangerous. Breathing in smoke from someone else who is smoking is called second-hand smoke. Remember, if you can smell the smoke, then the chemicals are getting into your body. Then, as I said, the tobacco industry is very, very smart. Advertising of tobacco and the lighter products have been banned in India since 2014, I think 4. But these companies, they use surrogate advertising and they advertise for, they advertise for all these tobacco goods in the disguise of pan masalas and the so-called hookah substitutes. All these pan masalas, 90% of them contain tobacco. Though they claim to be tobacco free, but all of them have addicting substance in them. And besides that, they contain arecanut, supari, which is very, very carcinogenic. So pan masalas used as a mouth freshener by most of the females and children is not, is as innocent as it is made out to be by the advertisements. The e-cigarettes. E-cigarettes were promoted as a weaning method for the regular cigarettes, but they are not used as a weaning method. It became popular in children, school children, college children, and it has been seen all those who use e-cigarette to start with switch to regular cigarette later in life. Most of the e-cigarettes contain nicotine. And secondly, the aerosol. The liquid they use has propylene glycol, which when heated produces carcinogenic substances. It contains all the toxic substances. So e-cigarettes are also not safe at all. Pan masalas, e-cigarettes, all these have been promoted as tobacco substitutes, but they are not safe at all. Then hookah lounges. Addition of hookah these days is a money-making option for the owners dealing in food business, restaurants, clubs, and the hotel owners. Most of them advertise them as the no tobacco products and no harmful effects. This is a myth. You cannot see my screen? Can you see my screen changing?
No, ma'am, it is stuck actually. It is stuck on one 7 slide only. It's not moving forward.
Okay. So just wait a minute, huh? I'll try. Wait a minute. So otherwise it won't serve the purpose. Just wait a minute.
No issues, ma'am.
बाहर है मेरे पास ना 28 एक मिनट पहले खोल लो बंद ये है 20 इसको हाँ खोल दो इसको नीचे आ जाएगी ना है जूम है क्यों मसला हो जाती है
विजिबल है और 90 स्लाइड ठीक है तो कौन सी स्लाइड पे
am I audible now? इसको बंद कर वहाँ देखो। ये मूव नहीं कर रहा स्लाइड। Am I audible?
Yes, ma'am, you're audible.
Yes, ma'am.
Okay. So we'll start with it again, huh? Okay. So I was talking about tobacco. It increases the risk of almost, cancers of almost all organs of the body. So this was about mouth cancers, and I was talking about how the tobacco industry specifically targets children and the youth. That's why the tobacco consumption among the youth starts. Then I was talking about the Indian adult population. 1/3 of the Indian adult population use tobacco in some or the other form. That is why in the whole world, the incidence of mouth and oral cavity cancer is maximum in our country. Can you imagine maximum oral cavity and the mouth cancers in our country because of the consumption of different types of tobacco? So I was talking about the second-hand smoke. It is also harmful, and the vulnerable group is females and the children. Then the surrogate advertisements of the tobacco industry, how the children, the youth fall prey to them. Then pan masalas and e-cigarettes, they are used, they are not the innocent bystanders, victims of the bans by the tobacco industry, but they are as harmful as the tobaccos are. So e-cigarettes, pan masalas, hookah lounges, they are all, the harmful options. So I was on this, how the hookah jo hai, most of them contain tobacco. They are made for the addiction purpose. And even if they don't have nicotine, they still contain carbon monoxide and the harmful substances. And one normal hookah session of about 1 hour is equivalent to 1 pack of cigarettes. So you can imagine how harmful these hookah sessions are, which have become a craze among the youth these days. So do not smoke or use smokeless tobacco. Smoking traditional cigarettes, e-cigarettes, or using smokeless tobacco are some of the worst things you can do to your body. Tobacco contains an addictive chemical called nicotine that gives smokers a pleasant feeling. E-cigarettes and vapes also deliver nicotine. Just because these products are high-tech, it doesn't mean they are safe. Using any tobacco product damages nearly every organ in your body and can cause heart disease and cancer. Smokeless tobacco is not a safe alternative to smoking. So then alcohol. Alcohol also increases the risk of cancer. It breaks down into carcinogenic substances. It affects our hormones. And the combination of alcohol and tobacco is deadly because alcohol is a very good solvent for all the chemicals present in tobacco. They enter into our body more easily. And it has been seen most of the time alcohol and tobacco go hand in hand. So combination of alcohol and tobacco is a deadly combination. Avoid alcohol also. Then obesity. Most of us know tobacco, alcohol harmful for health. We take obesity, most of the time for cosmetic reasons. We want to
decrease weight because we feel it doesn't look good. But obesity is a gateway for many types of diseases, including cancer. It increases the risk of at least 13 different types of cancer. Then, if you want to avoid obesity, avoid junk food. Junk food, do you know, just 12 ounces of soda, about 350 ml of soda contains 8 teaspoons of sugar. And normal one serving of French fries has 312 calories. So better is learn to read the labels. Then you will realize what is the serving size, and one serving contains how much calories and all. Then go for plant-based diet. Eat more of fruits and vegetables. Even non-vegetarian diet, processed meat has been put into the same category as tobacco by WHO as far as cancer is concerned. So avoid processed meat altogether. Then red meat has been put into the same category as alcohol. If you are going for a non-vegetarian diet, you can opt for fish, chicken, but avoid processed meat and red meat. Then exercise at least 30 minutes a day, at least 5 days a week. That is the minimum recommendations, because exercise is an independent protective factor for cancer. Then we have about 15% of the viruses which are responsible for cancer, like one of them, human papilloma virus, is responsible for a very common cervical cancer. Then hepatitis B increases the risk of liver cancer. We have vaccines for them. I'll go in detail later about the human HPV vaccine once I touch upon the topic of cervical cancer. So you should be aware, these are the preventive measures. Then, as I said, early detection improves the cure rate for cancer. Yes, we can cure cancer provided the patient comes to us in the early stages. If we talk about the early detection, if we talk about breast cancer, stage 1 breast cancer, 95% of the patients can be treated successfully. They can be cured of the disease. But if the person comes in stage 4, in the advanced stage, the survival goes down to just 20-30%. So early detection is very important. These are some of the warning signs. Know your body. Any abnormal symptom should not be ignored, like change in bladder or bowel habits, any wound, any sore that is not healing for more than 2 weeks, be it in a mouth or anywhere else in the body, unusual bleeding or discharge from anywhere in the body, vagina, anus, urine, any abnormal bleeding, mouth, should not be ignored. Thickening or lump in the breast or else in the body, difficulty in swallowing, change in voice or hoarseness of voice, if obvious change in what or more. These are some of the warning signs. But any symptom persisting for more than 2 to 3 weeks should not be taken lightly. You should consult an oncologist. If it turns out not to be serious, you get peace of mind. If it is serious, by getting, I don't need to say these signs and symptoms means you have cancer. But if it is serious, by getting properly treatment, timely treatment, you have the best chance of making a good recovery. Then, if we talk about the common female cancers, breast cancer and the cancer of the cervix are the 2 common cancers. They make up about 45% of the all female cancer. Almost 50% of the female cancer are either breast cancer or the cancer of the cervix. So, by giving protection from just these two cancers, you are giving yourself 50% protection. So, I'll talk in detail about the breast cancer and the cervix uteri. I'll talk about cervical cancer first. Cervical cancer is one of the commonest cancer in Indian females. And this is the cervix. It is a part of female reproductive tract. The mouth of the uterus is called cervix. It is one of the commonest cancers, but the irony is most of the Indians don't even know where the cervix is. Whenever we have a campaign for cervical cancer, because the common pronunciation is cervical cancer, they relate it to this neck, that is below the head. So many males come to us and they'll say they have a cervical problem. But this cervix has nothing to do with the neck which is below the head. It is actually the neck of the uterus. So, this is the cervix and it is one of the commonest cancers among Indian females, second to breast cancer. But I have taken this cancer first because it is a totally preventable type of cancer. Still, about 200 females die every day in India due to cervical cancer. 8 women die every hour, 1 woman every 7 minutes. This is a tragedy because it is a totally 100% preventable type of cancer. Still, we are losing so many women to this cancer. And this cancer is unique among cancers. Why unique? Because this is the only cancer we know what is the causative agent. When we talk about other cancers, we talk about these are the risk factors, these are the protective factors. You need to reduce your risk factors and increase your protective factors. We do not know what is the causative agent. Causative agent means that if this agent is not there, this cancer will not happen. So, this is the only cancer we know what is the causative agent. This is the only cancer for which we have a vaccine. This is the only cancer we can claim to eradicate, just like smallpox and polio. So, why do we say that? Because we know it is caused by human papilloma virus. We know the causative agent. Almost all cases of cervical cancer have had an infection with human papilloma virus, HPV virus. HPV infection is a very common infection. It occurs in almost all, more than 80% of the sexually active females. But the good news is 99% it clears on its own. ये अपने आप ठीक हो जाता है without any treatment. But 1% of the cases, this infection persists. And these 1% are the cases which go on to become cervical cancer. So, this infection, though the infection is very common, the total, the preventive measure for, you will not get the infection is just by abstinence, which is not a practical solution. So, but we have to take measures before the exposure to the infection, like it gets transmitted through sexual activity. So we have a vaccine. The ideal time is before initiation of sexual activity. Then if somebody has an infection, we have to pick up those cases where this infection is persisting it is not getting cleared on its own, so that those cases do not go on to become cervical cancer cases. And we have enough knowledge to prevent and early detect these cases. The only thing lacking is lack of awareness and initiative from the government as well as public. So, as I said, 99% it gets cleared on its own. The risk factor for the persistence of the infection are sexual intercourse at a very early age, before the age of 18, multiple sexual partners of either you or your partner, immune system defects like HIV, various other sexually transmitted diseases, bad genital hygiene, multiple pregnancy, use of oral contraceptive, prolonged use of oral contraceptive. Then tobacco consumption. It doesn't, just once. Manisha? So, this infection doesn't develop overnight. It takes 10 to 15 years to develop. It is not that you get the infection and the cancer will develop in a year or two. It takes 10 to 15 years to develop. So you have enough time to take action. These are the actions which can be taken. We can vaccinate our young girls before the exposure. Then we can screen those cases. Screening where either this infection is persisting or it is causing precancerous changes. So we have years to take action. So there is no reason why cervical cancer should occur. As I said, the preventive measure, two-pronged approach, regular screening and vaccination. These two things can eliminate cervical cancer. Besides that, maintain a good genital hygiene, abstain from sexual activity at a young age, limit your sexual partner, limit your number of children, protect yourself from sexually transmitted diseases, avoid smoking and alcohol. These will avoid persistence of the infection. So the right time to vaccinate the girl is young girls, 9 to 26 years age group, before they become sexually active. The preferred age is less than 15 years, 9 to 14. That is the most effective time to vaccinate. If we look at the dose schedule, less than 15, just 2 doses are sufficient. 2 doses 6 months apart. 15 to 26, 3 doses. First, as on elected date, second 1 to 2 months after the first dose, depending upon which vaccination you are choosing. Then the third 6 months after the first dose. Any gynecologist, any pediatrician will tell you about this vaccination, write the prescription and give you that. No pre-testing is required. It is given in the upper arm and without any pre-testing, no serious side effects, just local injection site soreness. And that too, 99% cases, that too doesn't occur. We have 3 types of vaccine available here in India: Gardasil, Cervarix and Gardasil 9. All of them are equally good with minor differences. I will not go into the details. It has 4 strains, 2 strains, but the 2 strains responsible for 80% of the cases are present in all the 3. Then it is a total, as I said, it is a totally safe vaccine tested in millions of people in the US and many other countries, So far, no serious side effects have been shown to be caused by the vaccine. Most common problems are brief soreness, local symptom at the injection site, similar to one experienced with other vaccines. So this is highly recommended. It is in the national immunization program of almost all the developed countries. So you can see it, 110 developed countries have this vaccine in their national immunization program. It is a totally safe vaccine, highly recommended for all the girls. It doesn't only give protection against cervical cancer, it protects against all these cancers, vaginal cancer, vulval cancer, but these are not so common. Our main concern is HPV associated cervical cancer. Among the non-tobacco users, it has been associated with oral cavity cancers also, HPV. So it gives protection against oral cavity cancer too. But this vaccine is not intended to replace screening tests. Screening means you are testing asymptomatic people who do not have any symptoms for the precancerous stage or for the persistent of infection. Even if somebody has taken the vaccination, she requires regular screening after she becomes sexually active. Later, after she gets married, she requires regular screening because it gives around 80% protection, not 100%. But none of the vaccines have 100% protection rates. So, screening tests for cervical cancer are Pap Smear test and the HPV DNA test. They are, as I said, they are done to detect disease at a precancerous or early stage cancer. Pap smear is a very, very simple test, a gynecological procedure recommended for all sexually active females after the age of 21. We collect cells from the surface of the cervix by a brush, look it under a microscope, and this Pap smear test can detect cancer at a precancerous stage before it has developed into cancer. Routine cervical cancer screening detects abnormal cells before they have a chance to turn into cancer. About 80% of the women diagnosed with cervical cancer had not had a Pap smear within 5 years of their diagnosis. They missed their screening. Then there is another screening test. We call it a HPV test. Human papilloma virus test, to detect whether this HPV infection is persisting or it has recovered. It can be done after an abnormal Pap test. Like if somebody's Pap test comes abnormal, we can do a HPV DNA test to see if there is a HPV infection. Or it can be done along with the Pap test. We call it a co-testing. You can talk to your gynecologist. If we go for a co-testing, once in 5 years screening is enough. Just once in 5 years for 5 minutes and gives you protection from a very, very serious disease. HPV DNA. A positive HPV test does not mean that the woman has cancer. That is very important. Because people go to a gynecologist, they go for a HPV DNA test and come out with a HPV DNA positive. That means they have an infection with a virus that can cause cancer. So we have to be very vigilant about it. But it doesn't mean that the person has cancer. So these are the cervical cancer screening guidelines. Less than 21 years, just vaccine. No screening is required. 21 to 29, just Pap smears only, 2 to 3 years. Because as I said, HPV infection positivity rate in this year age group is very high. If a sexually active becomes infected with HPV virus, even if her immunity is very good, it will take about 6 months, 1 year time to clear that infection without any treatment. But most of the time, 99% of the cases, the infection gets cleared. So we don't want to scare them by doing HPV DNA test in this age group. Most of them are newly sexually active and they can be HPV positive. After the age of 30 till 65, we can go for HPV DNA plus cytology co-testing every 5 years, once in 5 years, just 5 minutes. Preferred test, then we can go for cytology like Pap smear alone once in 2 to 3 years. If you are older than 65 and you have had 3 normal Pap smear tests in the last 10 years, then you can stop going for a screening, cervical cancer screening. You are no longer at risk for cervical cancer. Or if you have had your cervix removed as a part of total hysterectomy because of some non-cancerous lesion, then also you don't need to go for a Pap smear test. So the World Health Organization has made a call for 90-70-90 targets by 2030. What does this mean? They are claiming if we vaccinate 90% of our girls and 70% of the women are screened for this cancer by 2030 and 90% of the women get pre-cancerous treated, then it will no longer be a public health problem. We can eradicate cervical cancer, just like we have eradicated smallpox and polio. So these are some of the symptoms for cervical cancer, but I have taken the symptoms last because we do not want our patients to develop symptoms. We want them to come to us at a asymptomatic stage. Just like blood pressure, blood sugar, we go for regular checkups. Once in 6 months, once a year, we go to a doctor and say, "Hamara blood sugar check kar dijiye, blood pressure check kar dijiye." It is not that we are hypertensive or diabetic. Similarly, we want people coming to us for the preventive health checkup. Pap smear mammography as a part of preventive health checkup. It is not that they have any symptoms. But these are some of the symptoms. If somebody has bleeding during sexual intercourse, bleeding in between the periods, bleeding after menopause, foul smelling, blood-stained discharge persisting for a very long time, then immediately go to a doctor. These could be signs and symptoms of cervical cancer. So, the take-home message is cervical cancer is a serious disease but preventable by regular Pap smear test and HPV vaccination. Get informed, get vaccinated, get screened. We can eradicate cervical cancer. So now I'll talk about the second most common cancer. The breast cancer is the most common cancer among Indian females. Around 27% of the female cancers are breast cancer. And these are some of the risk factors for breast cancer. These are the risk factors which we cannot change, but knowing your risk is always important. Being female is the biggest risk factor, but it can occur in the males too. 1% of the breast cancer cases occur in males. So if some male has a lump in the chest, it should not be ignored. Because male breast cancer cases tend to behave in an aggressive manner. Then increasing age increases the risk of breast cancer. Family history increases. If somebody has multiple family members, suffering from the breast cancer, her risk increases. Reproductive, not having children, increases the risk. Menstrual history, long menstrual history, starting periods before the age of 11 and continuing after the age of 55, increases the risk of breast cancer. Then these are some of the risk factors which you can control. Obesity increases the risk. Sedentary lifestyle, not breastfeeding children, alcohol intake, prolonged use of hormones as a postmenopausal therapy or as birth control pills, not having children, all these increase the risk of breast cancer. So what we need to do, we need to increase our protective factors and decrease our risk factors. These are some of the symptoms of breast cancer: lump in the breast, nipple discharge, especially if it is a bloody discharge, redness or pitting of skin over the breast, just like a orange peel appearance of the skin. Then inversion of the nipple, retraction of the nipple, change in the areola, lump in axilla, anything could be signs and symptoms of breast cancer. So as I said, we cannot always prevent breast cancer, but early detection is key to beat breast cancer. Early detection can save life. Treatment in early detected breast cancer cases is very, very successful. Female can live a disease-free life after treatment. How can we detect breast cancer early? Breast self-examination, clinical breast examination and mammogram. All females should examine their breast after the age of 20, every month, once the periods are over. How to do it? We have the brochures with us. We'll bring them once we come to your college for a screening program, or you can see it in the YouTube. Like there are so many methods, but ideal is you should be aware of your breast, how your breast looks like. You should be aware of your own body. If you feel any abnormal change, go to your doctor immediately and get yourself tested. Clinical breast examination 20 to 40 once in 3 years after the age of 40 every year. Then there is another tool, mammography. It is recommended after the age of 40. Mammography is a type of an X-ray. It can detect breast cancer 2 to 3 years before a lump can be felt. It becomes palpable. There is a gap of 2 to 3 years before it can be detected by a mammogram. There are some of the myths attached that, you get exposure to radiation through a mammogram. This is the comparative data. A CT abdomen with contrast gives 50 times more radiation than a single mammogram. So one CT abdomen with contrast is equivalent to 50 mammograms. One PET CT is equivalent to 60 mammograms. So you can see the radiation dose from a mammogram is very, very less, and the benefits far, far outweigh any risk involved, which is not at all. The radiation dose is extremely low, and once a year mammogram does not increase the risk of cancer at all. A routine mammogram can detect a breast cancer size lump 1.1 centimeter size, and most of the cases who come to us, we have a lump size around this much, around 3.5 centimeters. And this takes about 2 years. So mammogram is a very useful tool, very good screening test, and can be very helpful in the early detection of breast cancer. So cancer is largely a preventable tragedy. If it's curable if detected and treated early. Cancer screening can save precious lives. Need is to change your lifestyle, screen annually, and prevent cancer. Thank you. What kills is carelessness, ignorance, delayed diagnosis, and the wrong treatment. Cancer is not a killer disease. So, thank you.
Thank you, ma'am. Your words were highly informative. Before proceeding with a vote of thanks, I would like to request everyone to kindly switch on their cameras for a group photograph. Thank you so much. Once a great man whispered, feeling thankfulness and not expressing it is like wrapping a present and not giving it. So today, I take the opportunity to pull all my gratitude into words. I deem it a great honor to propose the vote of thanks to all those who have helped us in making this webinar such a resounding success. First of all, I would like to thank our distinguished speaker for making this webinar interesting and meaningful. Today's webinar was full of knowledge and interesting facts. I would also propose my hearty vote of thanks to our chairman, Dr. R.K. Tandon, our director, Barkha Behel, who supported us in conducting such great webinars. I would also like to thank our principal, Dr. Shashibala, for moral support. And I happily express a vote of thanks to our staff members who guided us throughout in the conducting this event. And lastly, I would like to thank our great audience. Thank you so much.
There are 2 or 3 questions in the chat box. Can I take up or should I write it down? I think it's really useful for the others too. Hai na?
Yes,
There's
ma'am.
one question, will it be effective for us to take the vaccine after 30s? Yes, definitely it can be taken after the 30s. If the female is sexually innocent, naive, it will be as effective as almost as effective as at the age of 26. But if she is married, happily married for 4-5 years, actually the effectiveness goes down by the duration of, for how long she has been active, sexually active. The duration of effectiveness goes down. So if somebody is sexually active at 30, I would rather recommend Pap Smear and HPV DNA test for her. Then there is another question, what happens if a woman conceives after the first dose? If somebody conceives after the first dose, we will need to discontinue the vaccination schedule. She can take the second dose after she, after she delivers, she can go for the second dose. There is no need to repeat the first dose. And there are absolutely no serious side effects of the vaccine. It is totally safe. And there is another question, till which stage life can be prevented in breast cancer cases? Actually, the breast cancer is not a single disease too. There are many variants of the breast cancer, but if we look at them in general, even in the stage 4, we are able to save 30-40% of our patients. The treatment for breast cancer has really advanced. So even in the advanced stages, the treatment is good. Early stage, no doubt about it, the patient will be fully cured of the disease. Cure in the sense he will not even, there will be no requirement for any medication, lifelong medication. But even in advanced stage, the treatments are still good for breast cancer. There's so many questions. I don't know if I have to take up. Better is somebody else takes up the question and let me know which I should answer. If somebody has asked if we are below 21, how can we make our parents understand that HPV vaccine is important? It is like, it should be, part of the counseling. जैसे pediatrician के पास आप जाते हो, pediatrician कहता है now you are due for these vaccines. Now you are this age, you are due for these vaccines. This, in the similar way, it occurs in all the developed countries. Once you turn 11, 12, the pediatrician will say, now this vaccine is due for you. It should be part of the national immunization program, but we being a country, we cannot afford all these things. And it's not a very costly one, in fact, just around 3,500 for a single dose, 3,500. So all those who can afford should go for the vaccine. All those who can pay from their own pocket should go for the vaccine. And I think it's not difficult to convince the parents once the doctors, the gynecologists and the pediatrician are there. So
thank you so much, ma'am. It was a wonderful session. I would request all of you to please switch on your videos for a group picture. We were not able to take the picture in the last time. Everybody, please switch on their videos. It is done. Thank you so much, ma'am. It was a lovely and very wonderful session.
Thank you. And somebody has asked, is there any preventive vaccine for breast cancer? There's no vaccine for breast cancer, actually. And as I said, the preventive tests are actually the screening test for early detection. The preventive measures are, you just need to reduce your risk factors, what I told you about, and increase your protective measures.
Thank you, ma'am. Thank you so much.
Welcome, welcome. So should we leave?
Yes, ma'am. Sure.
Bye-bye.